Surgeons of Reddit. What was your oh crap moment? I was doing a corneal transplant when I had the oh crap moment. During surgery, I cut off the patient's own cornea and replace it with a new donor cornea. During that moment, when the host cornea was off, but before I could get the new one on, there's literally nothing on the front of the eye except a tear film and aqueous humor. Anyway, the patient takes that moment to start vomiting. The reason we tell everyone to skip food and drink is so they don't aspirate in case they throw up. This patient lied about eating breakfast and started throwing up everything. The eye is still open scar at this time. Everything inside of the eye can now become outside of the eye, and she's bucking and vomiting. Those not in the know will say this is not good. Those really in the know will say oh crap. Anyway, I had to grab the new cornea and start stitching as fast as I could on a patient actively throwing up. I used 10-0 nylon sutures which are thinner than an eyelash. It turned out okay but not great. Don't lie about eating breakfast before surgery, folks. Doing a C-section for this poor mum who'd been in labor for hours. Baby wouldn't come out of the hole we'd made, so more pressure was applied to the fundus top of the uterus and suddenly whoosh, baby zooms out like a torpedo, covered in lubricating vernix, zips over the surgical sheeting which has the texture of a slip and slide and almost rockets straight off the table. The baby's foot was caught by the reg who whipped her up in the air upside down like in old cartoons, but almost dropped her again due to gloves vernix. Thankfully the midwife was ready with a towel and caught the baby to wrap her up. Mum and dad seemed to think this was normal practice and didn't notice, but me and my colleague just stared at each other with a look of absolute horror. It still makes me shudder to think how close the baby was to hitting the floor head first. Never happened before or since. When I was a new RN working the ICU in a large teaching hospital, I came into work one morning to a patient that was admitted that night. Intubated, breathing tube in, sedated, Farley catheter tube in PP hole and all. Long story short, he was extubated, breathing tube out that same shift and was completely alert and oriented. He was an end-stage renal patient, meaning his kidneys didn't work and he needed dialysis, and was only in his late 30s. Said he never made urine anymore and didn't need the Farley catheter, so he wanted it out because it was hurting. Now the catheter bag had been empty my whole shift, which is normal seeing as how he didn't make urine anymore, and this hospital had a nurse-driven Farley removal policy, meaning while we needed a doctor's order to insert one, we could remove one at our discretion, unless a doctor specifically put in orders not to. This patient had no such doctor order, so I went to remove the catheter. They are held in the bladder by a balloon on the end that is inflated with 10 milliliters of saline. I deflated the balloon, removing 10 milliliters of saline, and pulled it out. As soon as the catheter left his penis, blood started pouring out in a heavy stream. Turns out the nurse who placed it on admission hadn't advanced it far enough, since there was no urine production to indicate correct placement, and had inflated the balloon while still in his urethra, causing trauma. It would not stop bleeding. I had to hold this man's penis shut to put pressure on it, while my co-worker Paige, the resident who came and looked at me with pity as he told me to just keep holding this 30-something-year-old man's penis in my hands to staunch the blood flow until urology could get there to assess. It just kept gushing blood every time I eased up to check. For over an hour total I held this man's penis and tried to make polite conversation until the urologist arrived. I work in the OR and have seen some pretty interesting things. First day on the job, the surgeon was doing a lap sleeve gastrectomy. During this procedure a medical device is used to cut and staple the stomach simultaneously. However, in this case the medical device failed. The stomach was cut open, but the staples never engaged, which left the patient with an enormous gash in the stomach. The surgeon ended up finishing this part by hand. I got called into a room to ensure the laparoscopic camera was working and able to record. This was a 6-hour cardiac procedure and was nearing the end, so I knew I was about to see something good. The surgeon pulls out some kind of growth from inside this guy's heart. This thing was the size of a chicken wing. It was growing through his valve and I'm honestly amazed they were alive. Supposedly the only symptoms were shortness of breath. not a surgeon, but was working in obstetric theatre in UK at Etoile last year. This is important as maternity wards are kept quite warm as newborn babies aren't good at regulating their temperatures. Combine this with a heat wave and the fact that in Britain we are not exactly used to high temperatures and we have the perfect storm. Mid-emergency Casserie and the scrub nurse assisting the OP starts feeling faint. This is unusual as this scrub nurse worked in these theatres full time, so this was her bread and butter. So I can only conclude it was the heat. She has to step out, so the show takes her place assisting the obs registrar with the section. This show looked extremely junior, as in first section ever, and they were trying to assist with the instruments in the uterus when they fainted. I had to jump in and grab the back of their theatre gown to stop them faceplanting the open uterus, and then sort of gently tug backwards to let them fall into me when someone else has taken over assisting. This show was not exactly small. Thank God the baby was already out. When I was younger, I had a rather complex external fixator cage applied to my leg. It had 3 rings, 2 large 360-degree rings around my leg, one in the upper middle of the shin, one in the lower 0, which had humongous rods to keep the cage fixed to my leg, and a third one, which was a horseshoe type ring around my ankle, which threaded all sorts of pins through my ankle, each pin set in a certain way. The point of this external fixator was to relocate and fix the positioning of my ankle so it wouldn't be so ducked. Basically, I have had a birth defect called Talipes clubfoot equines. A lot of bone got removed before the fixator was put on, so this way it could all grow. It was a 9-hour surgery, and my doctor, who I won't name, was pretty chuffed with himself after seeing it all installed on my leg. This was until he looked closer. The pins I spoke about before, with the numbers on them almost like those sizing things on cheap Cothangers, were all colored and numbered, set for my dad to do every morning and night. He was looking at the pins and the numbers. He looked glance away and looked back with a stressed face on. After a few seconds and a slight hand on head gesture, he whispered shit. In his mind, he had organized the pins in an incorrect way. He was stressed beyond his mind for a few minutes. He was worried he ducked everything up. Luckily he hadn't. He just needed to move 1 or 2 numbers. 1 year later, 8 months after the frame was taken off, which was in for 6 months, I ended up having my leg amputated. The surgery didn't work how we wanted it to, or at least how I wanted it to, which we were sort of expecting. The goal was to get me walking. The amputation got me running. Bear in mind, the amputation was my call. I was 12 when it was done. Best decision I ever made. 5th year resident here. There are lots of bad oh shit moments throughout training, such necrotizing soft tissue infections, or takebacks for bad complications or deaths during cases. However, I'd like to share a recent positive oh shit moment. 15 centimeter kidney tumor with thrombus into the vena cava. Big incision. Great exposure of the vasculature in the tumor. My attending and I are dancing around the aorta and vena cava. We are able to feel the tumor thrombus in the IVC. I was expecting that we'd need to cut and clamp the vena cava to get all the cancer out, but my attending literally squeezes the tumor out of the vena cava back into the renal vein, and then has me tie the renal vein off so the tumor doesn't slip back into the vena cava. Patient went home in like 4 days. Margins were negative and is still doing great. First time I felt like oh crap, I'm a surgeon. Surgeon here. I've dealt with loads of morbid stuff, but one thing that made me stop and go oh shit was a conversation with a young patient who had a perforated colon from diverticular disease, which is a common wear and tear of the colon. He was one of youngest patients I had seen with this condition, and certainly the youngest with a perforation so bad as to require an operation. When I was counseling him on the operation, which involves removing the perforated part of the colon and giving him a colostomy, he told me his biggest concern was how he was going to have anal sex with his same-sex partner. He would only have a small stump of rectum left inside, which would be at risk of perforation with any force applied to it. It made me really think about the implications of the surgery we do. The operation is the easy part. I was a patient. I had a liver transplant and was having an ERCP done to place a new bile duct stent. Well, apparently my anatomy is different than normal, and my lungs go more down my sides. so he accidentally caused a nick, which caused a hemothorax. So when I woke up I couldn't breathe. They did an X-ray and had to do a chest tube. Eventually I was so exhausted I asked to be vented, so he vented me. Apparently he cried, he felt so bad about it all. But it wasn't him being malicious or negligent. It was simply an accident. Not a surgeon. Thought I'd share this though. Husband went in for a routine colonoscopy, and as they were prepping him, anesthetist asks him if he's a ginger. My husband tells him yeah. When he was a kid growing up, he had fire engine red hair, though it's faded to a more strawberry blonde now. The anesthetist laughs and says, "Okay, I gotcha. We'll give you the redhead dosage," and winks. Well, my husband thinks it's a funny, until he wakes up at the tail end of the procedure, pun intended, and doctors are just chatting it up, and what have you. Turns out it's not a joke and redheads have some type of natural block to anesthesia. Dude had given him maximum allowable dosage, and he still woke up. Happened a couple years later. They gave him ketamine and some other shit to knock him out, to get wisdom teeth out. When he told dentist about the colonoscopy thing, he still woke up at the end of that one too. Happened at my hospital. A mentally ill young woman who was pregnant at the time was in denial. Locked herself into her room when she realized the contractions were coming. She basically didn't push, and the baby didn't come naturally. Her family called 911 because of the smell. The emergency room realized her baby had died inside her and was basically rotting due to the smell. She was taken to the OR to remove the baby, and apparently all the nurses and surgeons were vomiting because once they opened her up the smell was overpowering, and it was traumatizing to see a rotting baby. Had a no crap moment as a patient on the operating table. A couple of years ago I was in labor for 28 hours, pushing for 6, when my child started showing signs of distress. He had slightly elevated heart rate, and I had the makings of a fever. My midwife at the hospital told me the doctor was coming in to check to see if a vacuum assist could help. She checks me and immediately stands up with blood on her hand and says, "We are going to the OR now." At that time, I started feeling that zoomed out tunnel vision I know for me is shock. I had anxiety, but figured she knew what was best. She did. We got in the OR 8 minutes later, and when they opened me up, I heard the surgeon say, "Oh crap, look at this." They say blood in my catheter bag, and upon fully opening me up found my son was actually trying to come through my uterus. He had ruptured it. They got my son out. Those moments where he was stunned and not crying were an eternity. He cried and he was born a completely healthy baby. After I woke up and was back in my room, the doctor came in and told me what happened. I knew a ruptured uterus sounded bad, but oh damn, I googled and started having a massive anxiety attack. A ruptured uterus is extremely rare and so very dangerous and often fatal. I read from the time it happens you have about 15 minutes before you bleed out and baby is dead. When I went back for my post-section follow-up, my midwife let me know, as a practice that's been around 35 years with over 30 midwives and doctors, they had never once encountered that, and it was such a big deal for them. A few days after my birth they all got together to discuss my case. I was so incredibly fortunate I chose to labor in hospital that the doctor just knew from my vitals and babies that something was off. They just didn't know until they got me open. I can't even tell you how grateful I'm for doctors. You saved my life and my son's life, and our family will forever be grateful. Not me, but my uncle. He's a respirologist and was supervising sitting in on lung surgery to remove a tumor. Turns out the tumor was a root ball. Some type of seed had gotten into the patient's lungs and started to grow. Consider subscribing if you enjoyed this video, and if you want to see more of Reddit Universe,